So, ladies and gentlemen, we are here in Trinidad and Tobago.
We had our first confirmed case of the coronavirus here in Trinidad.
Trinidad and Tobago has received confirmation of its first case of COVID-19 or coronavirus.
It's a 52-year-old male who flew into the country from Switzerland on Monday, the 9th of March. That is this Monday.
So we have our first confirmed case of the coronavirus in Trinidad.
So now arrangements are being made to have the patient transferred from his home via suitably equipped ambulance services with all PPE to the Cora facility, as it is a mild case.
So in the beginning, the coronavirus will cause kind of like flu-like symptoms or a cold. So people just get the stuffy nose, that kind of thing.
It's from a family called the coronaviruses. The symptoms of this illness are pretty mundane on the face of it. It's a dry cough, fever, and then breathing problems.
So the first symptom tends to be fever, which is a good symptom to have initially because it is measurable. That's why screening of temperature is appropriate in this aspect. You could also have cough and shortness of breath. So if it is that you do have these symptoms, they are non-specific because they belong to any sort of respiratory illness.
There is a need for concern. There is a need for heightened vigilance. But there is never a need for panic.
And the government's best advice to the people is don't panic.
Everybody panic buying right now for the COVID-19 virus, and I went yesterday just trying to get a couple little sanitizers running the keep, not much to overbuy, and I couldn't get any. So I'm going this morning bright and early, Pennywise Shagonas here. Current situation in Pennywise, it's not 9 yet, it's minutes to 9, and as you guys could see, the car park is basically full, people lined up. There is a extremely huge crowd waiting for them to open, and is, well, in approximately 7 minutes they're gonna open.
Well, they need to hire writers to come up with better words than just don't panic, because saying don't panic to Trinis in a crisis is like saying calm down to a woman in an argument on her period.
Plenty workers up and down. Care, get toilet paper to use, have soap to wash your hands in the toilet.
And people from all over the place is just running to Price Mart to buy Lysol and do all sort of nonsense.
And it's a word which I think we need to expunge from our vocabulary right now. And I'm appealing to mainstream media not to use that P word. Because when you do that, you send subliminal messages to the public. We have been transparent. We have been honest from day one. There is absolutely no need to panic buy anything.
And the whole of Price Mart, Trinidad and Tobago, everybody running to buy Lysol at the grocery.
They don't have towels to dry their hands.
So, I can't understand why it is we are panicking and being afraid. People, fear is going to kill us with this virus. This virus was here since before Carnival. And it's now that they are confirming in March. We had Carnival in February, and now we are in March.
Good, much less hand sanitizers. I have a sister of mine went to a particular health center, and there was nothing at all for that person to dry their hands, to wash their hands.
Just like all viruses, it needs to reach a target, which is your lung. And it has to get there with your help. It has no feet and no wings. So therefore it needs us to move it there. So that's why we keep saying, don't hang around sneezy people because you're gonna breathe it in. And don't touch your face because that's how the virus is gonna get in.
So there actually isn't any treatment at the moment at all. Because this is a virus, antibiotics won't work. They only work against bacteria, not viruses.
The masks are helpful, but they're not necessary because they're leaky. The ones that you and I buy basically have pockets here, so therefore the virus can get in.
Not nationals or are not permanent residents of Trinidad and Tobago, and they are from these places that I mentioned, they would be denied entry into the country, totally, point blank period. If persons are returning from these places and they are nationals or permanent residents of Trinidad and Tobago, they will be placed under 14-day quarantine.
What the masks really do is they stop us from touching our face. If you're sick, we tend to mask you, so therefore you're not spewing out the viruses to other people sitting around you. The true people that have the real masks are the N95. Those are sealed. These are for the doctors that may be caring for the patients.
So we currently have travel restrictions imposed on persons coming from not only China, but South Korea, Singapore, Italy, Iran, and now recently, just today, France, Spain, and Germany has been added to the list just because these are where the coronavirus cases worldwide have been clustered so far. On February 27th, Health Minister Terence Singh announced that the Couva Hospital would be used as a centralized hub for treatment for COVID-19 if it is that there are a large number of patients or if there's a serious outbreak. Another 67-bed facility is available in St. James if necessary, and another facility is to be opened in Port of Spain soon.
Yeah, good night, sir. Good night. We get a call at 20 minutes, child. We get a call at you feel you have the coronavirus?
Yeah, I feel so, boy.
Alright, what you have? Well, I see you have cough.
Yeah, boy.
Headache, you have headache?
Real headache, boy.
Shortness of breath?
Yeah.
Okay. Muscle pain?
Real joint pain.
What about fever?
Yeah, fever like that.
Alright, well, don't panic, right? Let's confirm you have the coronavirus, right?
Yeah.
Don't panic, because we are trained. We are trained to deal with this, right?
Okay.
We are ready to deal with this. Just get your stuff there. Damn these things, yeah?
The important point is that he basically self-isolated. So even before symptoms began presenting themselves, he took a decision not to go out to work, not to go out in public, not to put himself and the public at risk.
A passenger on a Caribbean Airlines flight from New York to Guyana via Piarco International Airport tested positive for COVID-19. In a release, CAL said the passenger who traveled on March 7th on BW 521 from John F. Kennedy International Airport, New York, to Piarco, Trinidad, and on to Chedi Jagan, Guyana on BW 526, subsequently tested positive for COVID-19 at a public health facility in Guyana. CAL said, in accordance with established protocols, the public health authorities have advised that, as a precaution, the 13 crew members associated with the flights be placed on self-quarantine for a period of 14 days. CAL said this was done and the employees will be assessed and monitored. It added that the public health authorities are also contacting all persons who may possibly have been affected.
So just remember, your hands may be with virus. Virus cannot hurt you because it can't get through the skin. But the moment I do this, now I've brought the virus right to where it wants to go. So let's remember not to touch our hands to our face.
So do things like washing off your hands. Don't touch your face. Don't do like me and after the post-carb, shake the CMO hand by reflex. You know, cough into your elbow, you crook off your sleeve. Wash your hands, wipe your hands when you touch hard surfaces. And I'll give you an example. You know what's the biggest danger to us now? This hard surface. When you touch it, you lend it. You know, when we take a call, we say, hey, take this call now, and then you put it back here. That is how the virus is transmitted. Cell phones, credit cards, keys, doorknobs, bank cards. So I am asking for social responsibility. Let's broaden that and we will get through this together. It is not Armageddon. It is not a disaster. There is absolutely no need for panic, but let us be our brother's keeper in all of this, and together we will get through this. Thank you very, very much.
Thank you very much, ladies and gentlemen.